Knowing when your child is too sick to go to school has always been an area of concern for parents. Today, as we confront the COVID-19 pandemic, that issue takes on even more importance. Hi, I'm Kandy McClain, the nursing supervisor with the Roswell Independent School District. The health and well-being of your child is our primary concern. In this video, we will address some of the questions you might have regarding when and how long you should keep your child home if they are ill, for their health as well as the health and safety of others.
We ingest, inhale, intake viruses constantly. They are everywhere on Earth. Even though we do our best to prevent contracting these viruses by doing things such as washing our hands and using hand sanitizers, sometimes diseases are still transmitted.
Hi, my name is Kandy Chamberlin. I'm the school nurse at Washington Avenue Elementary. What can we do to protect ourselves and others from getting sick during the school year? Washing our hands frequently and thoroughly with soap and water, covering our coughs and sneezes,
using hand sanitizer appropriately, checking our temperature before school every day, even when feeling well, staying home when sick.
Fever of 100.3 or higher, cough, shortness of breath, or difficulty breathing.
Chills, repeated shaking with chills, muscle pain, or headache.
Sore throat, cough or congestion, new loss of taste or smell, persistent diarrhea and or vomiting.
If your child has tested positive for COVID-19 and they have symptoms, they must be fever-free, improve respiratory symptoms, and have 2 negative tests at least 24 hours apart to return to school.
If your child has tested positive but does not have symptoms, they must remain home for 10 days. Before returning to school, they must have a medical release from their healthcare provider.
If your child has been around somebody that has been diagnosed with COVID-19, they'll need to stay home for 14 days following the time of their known exposure.
All RISD families will have access to a registered school nurse. You're welcome to call them at any time with questions during the school day. We will continue to follow CDC guidelines and will be working with our local health department and community healthcare providers and resources to provide the best care and support possible. We know this is an emotional and challenging time. The health of our staff and students is our top priority in the Roswell Independent School District. Thank you for entrusting us with the health and safety of your children, and thank you for doing your part to help us keep everyone safe and healthy.
My name is Daryl Evans and I am the Custodial Maintenance Supervisor for RISD. In the Roswell schools, we have realized how important disinfecting and cleaning is at this point in time. We've been utilizing products such as Husky for several years, and it's well documented to kill germs and disinfect school facilities. We use this for everything from floors to ceilings and has been effective in classrooms, bathrooms, and everything in between.
But we use a foaming Q&A to clean and disinfect. We also put that in a spray bottle and dilute it to clean our water fountains so it knocks out scale plus it cleans and disinfects. The other product we use is Husky. We use this in our mop waters, wiping down doorknobs, walls, all surfaces is what we use this stuff for. We can dilute it also, put it in a spray bottle so the teachers can have it to disinfect stuff in their rooms. The other stuff we use is the hand sanitizers, which are in all of the classrooms. This is the machine that we use to clean the bathrooms. It's called a Kivac. The high schools have up to 4 or 5, but every school has at least one of these. We'll take this wand and we'll put a mist of Q&A mixed with water on all surfaces. And then we'll go in there with this brush. We'll brush all of the floors, and then he'll come back, he'll rinse it, and then he'll vacuum everything up. The nice thing about this piece of equipment is even though we're killing all the germs, just like a bucket and bleach would do, we're also vacuuming them back up. So we're not doing any cross-contaminating anywhere. Once we use this machine in this bathroom, all the wastewater is put into a holding tank, and then we just get rid of it in one of the toilets or a mop sink or something. But there's no cross-contamination on anything as long as we use this machine the way we've been trained to use it. The nice thing about the Husky is we're not getting all the fumes and the stuff like we do on Clorox that bothers some people. This just has a real light kind of a mint, peppermint scent, and it doesn't bother people like some of the Clorox stuff does. This is our Unger mop system, and we use this to clean walls in classrooms and bathrooms. So you notice that there's a green pad, that's for halls, classrooms, and then the red pad is for nothing but bathrooms. That way we're not cross-contaminating. If we're using the mop in the hall, it's more for spot mopping. And we have at least one of these at every school, and you can see once it's done, it's just as dry as when you started, so we don't have any problem with people slipping and falling.